Thank you so much to Minister Michel for really shining a light on Canada and its proactive and pragmatic approach to health innovation, showing us how Canada is not standing still and where speed is the essence when it comes to health innovation. Now, unfortunately, due to a last-minute change, we don't have a voice that we hoped would contrast of what is happening in Canada. The Minister of Health of Indonesia is unable to be with us this evening. But I do think we can all agree on one point this evening, and that is that we are at a critical inflection point. A critical inflection point and a golden age of medical science, where cutting-edge vaccines and medicines exist, but where widespread and equitable access remains the stubborn challenge. So what is it going to take, really, to truly move and shift from innovation to delivery at scale, from sick care to healthcare? Now, to help us understand this question and what it really means, I'm delighted to be joined by one of the leading voices in global health, and that is Michel Demaré, who is the chairman of AstraZeneca. Do come and join me.
Good evening.
And welcome. Michel, you recently spoke about how we're entering a period of extraordinary scientific progress, from AI to precision medicine, biologics, we also have cell therapies. So from your perspective, what would you say is the biggest shift that is needed to ensure innovation, as I said in my opening question, is available to patients at scale?
Yes, thank you for that. And yes, indeed, I think we all agree that we are at a very exciting moment in terms of science. The progress that we have seen over the last years, you mentioned some cell therapy, gene therapy, the weight loss products and all the side benefits that they can generate. There's so many things you could name that, in fact, we can now look at diseases that used to be considered fatal that now can be turned into chronic diseases. Even cancer in a few years is for sure not a disease that everybody will die on like we have now after a certain while. So it is really so exciting. You mentioned it yourself. You stole my line actually there, that I was going to say 70% of what we see as life extension nowadays is due to innovative medicine. So it is really quite impressive from that point of view. And it's also needed, because if we think over this planet, 2 billion people live with a chronic disease, and it is increasing all the time. So if science is not there to catch on all that, it will really become a problem. Now, where the problem is that science is going very fast and policy is not following. And that is clearly a problem that we see growing more and more. And it comes down to what you were saying in your introduction as well, is that there are too many places where medicine is considered as a cost that need to be brought down at any point in time. Everything should be generic. So obviously we forget that the generic of today is an innovative medicine of yesterday in which a company has invested billions to make it work. And so we need a mindset change here to look at medicine, and especially innovative medicines, as an investment for the future. And it's so easy to make the point about that, because it starts, for instance, investing also in prevention, in early detection. If you see it nowadays, and these are numbers from the WHO, that every year there's 1.8 million people in Europe who are dying from a disease that could have been detected on time and prevented and treated early. It's amazing to just think about that. And obviously, innovation is also paying for itself in a certain way if you have the time for it, which is always a bit the problem, because when you talk with governments, the timeline is 3-4 years. But it is clear that if you invest more in prevention, you invest more in treatment, you detect things early, and you invest in the right medicine, what you will do is keep people out of the hospitals. And that is still, for most of the countries, the major part of a budget is hospital treatments. It's late operation operations, too late operations that will only extend life for a short period. So you need a completely change for that to do. I think another argument of investing in innovative medicine is economic growth. If you have a healthy population, you have less sick days, people have a better productivity. And there as well, there's been studies made that show that by 2050, with a healthy population, the GDP could grow another 7%. If you take 7%, that is the GDP of Germany and Japan combined. So there's a lot of impact on that. And now add the last one, which has become more of a talking point in the last couple of years. We all speak about sovereignty nowadays. And a lot of countries now have agreed to increase the defense budget to have a sovereignty in terms of defense, to which I always say, well, what about health? What is the point of having sovereignty in defense if you depend on another country to take care of the health of your population? So there's a lot of things here that we need to consider, and we spend a lot of time nowadays in talking with government and trying to change this mindset, but it's not an easy.
And on that point, then, as you're saying, it's a question of changing mindsets because the data is there. You've just explained to us so clearly that it is there. So how should leaders think about balancing this question of cost, of affordability, with the need, the current pressures, I guess, with the pressures also of, financing and sustaining innovation tomorrow?
Yeah. And of course, I understand this short-term pressure too. Everybody has a budget to fulfill, and the health minister receives the budget she receives, so he receives from the finance minister, and you have to try to deal the best out of it too. And obviously, this is an annual exercise that comes down and for which you have to look at solutions. On the other side, you also see the aging of the population, the increase of NCDs year over year. So it's a spiral that will become more and more difficult to control. As well, science leads more and more to personalized medicine, which is also more expensive. So it will be even more difficult for public health systems to be able to sustain that in the future. So you need a change. Short term, I've already mentioned one, is the prevention and early screening. On average, OECD countries spend 3% of their healthcare budget on prevention. It should probably be 2-3 times that to really start having an impact. And obviously, these are things that can also work with public-private partnership to help out doing that. You can also invest in digital and now in AI to make your health system first more productive, but also to reduce the cost of diagnostic and treatment. But at the end of the day, there must be a win-win situation for the governments and for the producers. And obviously there, the pressure is huge. You have now heard of the issue we are dealing with the MFN tariff, MFN agreements in the US. And obviously when you discuss with governments, they always say, yeah, okay, now we're in this situation, the Americans force us to spend more. To which I say, yes, in a certain way, but it is also the result of 20 years of underinvestment in innovative medicine. And I think we have to really try to find a way now to change the system. We cannot continue having prices that are 3-4 times, sometimes even more, lower than the US. It's a fact the US has been financing medicament innovation since 20 years, and we need to rebalance. The pity now is that we have to do that so fast. But as the minister said as well, I think everybody has to regain a certain autonomy and independence. And it can only happen if we start looking at further investments and doing it. It's a specific industry here. And in a way, you could simplify it saying we are selling to governments because either we are selling to hospitals or we have our private patients that get reimbursement. So the same governments that ask us to invest in research or in advanced manufacturing don't want to pay for the real value of this innovation too. And so there's a point here where we have to get people together and try to work on a long-term plan to change it. We cannot change it in 3 years, but I think in 5 to 10 years, there's a lot of things that can be achieved to obtain a better sovereignty and independence in that point.
Okay, so then just finally, just to wrap this up, if you are to be able to initiate this step change, and you meet world leaders, you meet people at the very cutting edge of innovation, how would you see this step change taking place, where these different parties work together?
Yeah. A public-private partnership is the only way to go. I'm really convinced of that, and we spend more and more time trying to find opportunities to do that. And in fact, we are already doing that today at AstraZeneca. We have created 3 years ago, just after COVID, the Partnership for Health System Sustainability and Resilience, or PHSSR, not easy to pronounce. It's actually a partnership that we started with the London School of Economics and the WEF, and where we are basically sponsoring studies at country level to make a full assessment of the viability of a health system, trying to see if they have the right governance, if they spend the money on the right thing. And so it comes with all kind of recommendations. It's each time done by local experts. We have done that in more than 30 countries, with a set of recommendations, and then we create a round table where we discuss with the ministers, with the head of hospitals, with academics, with people from the insurance companies, and try to find solutions to help bridge that. And so, for instance, nowadays, based on these studies, we have already created more than 200 partnerships around the world to try to work. It's sometimes very small projects, but just work together, implementing AI, for instance, to read the results of an analysis or of an MRI, for instance, and gain time, have more accuracy. And so there's a lot of things here that we can do together to make it happen. At the end, what we have always to focus on is how can we work together at this always innovating concept of saying this is the solution for the future. We have to find a way that we both can live with that.
Thank you so much. And as you said, with so much clarity, this is a win-win situation.
Yeah.
Very deep thanks for your cogency and your clarity. Please do thank Mr. Demaré with me.
Thank you.